仔咧係3月11號7點差唔多係7點半嗰陣時咧，咁我就量佢體温啦，咁佢就係38度5嘅發燒嘅。
Mary Wan's son and husband recently tested positive for COVID.
咁佢一明愛之後咧，都係要排嗰個急症室嘅。但入院咧要等2至3日。如果期間咧你等唔到嘅話咧，你可以自己返屋企嘅個感覺。
But isolating at home was nearly impossible. The couple and their 2 kids live in just a 150 square foot apartment in Sham Shui Po, one of Hong Kong's poorest neighborhoods. Her family is one of many affected by the Omicron outbreak that has swept through the city and breached its border and quarantine defenses. For over 2 years, Hong Kong was able to largely keep COVID out. But as of March 2022, more people are dying from COVID here relative to population than anywhere else in the world. Images of chaotic, overflowing hospitals and body bags stacked next to living patients. This has become the dark reality in a city living through one of the deadliest outbreaks of the entire pandemic.
Morgues are full.
What is the end game here?
The frustration, the worry.
Since the start of the pandemic, Hong Kong has strictly followed China's broader COVID-0 strategy, a suite of policies designed to stamp out every outbreak the moment it's detected. This included mandatory hospitalization of positive patients, regardless of symptoms, and aggressive contact tracing. Close contacts were also sent to quarantine camps, while inbound travelers were subject to hotel quarantines of up to 21 days. But with Omicron quickly wreaking havoc throughout the crowded city, public hospitals and health workers were overwhelmed.
因為你唔係做決策啊嘛，其實都係好無奈，亦都好憤怒咁樣。點解即係嗰一班喺辦公室嘅所謂管理層啊，佢哋有時間都係會即係有時間點解唔可以即係進行一個更加好嘅長遠規劃，同政府多啲溝通，政府多啲同公營醫療衞生系統嘅機構去溝通。
And so far, our measures to contain the spread of a disease remains a legitimate and valid one. The problem we are facing is given the magnitude, the pace, and the severity of this 5th wave, it has outgrown our capacity.
So, how did Hong Kong go so wrong?
The environmental conditions, densely populated housing estate, was the key factor that led to the explosive outbreak in Hong Kong. But what caused a high mortality was mainly because of the low vaccination among our elderly.
Roughly 90% of deaths in this latest wave have been amongst the unvaccinated, particularly the elderly. The city also botched public education campaigns and allowed misinformation about vaccines to spread.
When we first rolled out the vaccination program, the government at that time was concerned about the safety of the vaccine among those with chronic illnesses. If you could dispel the misconception at that time, rather than asking those with chronic diseases to delay vaccination, people might not develop the misconception that these vaccines are very dangerous.
我相信咧喺過往嗰2年咧，政府係一路冇重視院舍嘅防疫嘅問題，可以咁講，導致今日第5波咧，即係老人家承受呢個惡果。我覺得呢個係令到社會係好清楚睇到嗰個事實喺邊度嘅。
Hong Kong's situation stems in part from Beijing's decision to take greater control of the financial hub following 2019's pro-democracy protests.
On the one hand, in the beginning of the Omicron outbreak, you see medical experts in Hong Kong suggesting it is too contagious, it is not feasible to maintain a zero COVID policy. And then in late February and early March, you see Chinese official scholars and official media in Hong Kong started to publish article after article attacking this living with the COVID approach.
The virus-induced chaos has prompted an exodus and may have permanently damaged the city's reputation as a business hub.
So you see this kind of intensive lobbying by the global business community in Hong Kong. And at the same time, the Hong Kong government has to show their confidence in the China approach.
I have a very good feel that some of our financial institutions are losing patience about this sort of isolated status of Hong Kong. And Hong Kong is an international financial center. Nobody attaches as much importance as myself to Hong Kong's international status under one country, two systems.
For the city's poorest families, Hong Kong's failure in preventing the deadly outbreak makes them fear for the future.
自己唔係住劏房，咁可能就心情啊或者係壓力啊，就可能就冇咁大咯。